Hello, my name is Fernando, and today I'm going to present to you the results of my review entitled Influence of Probiotic Supplementation on Gastrointestinal Complications in Colorectal Cancer Patients, a Systematic Review and Meta-Analysis. GlobalCan estimates that during 2018, there were approximately 1,800,000 cases of colorectal cancer and 900,000 deaths attributed to it. Its incidence only tends to grow, with an estimation of 2 to 5 million cases annually until the year of 2035. The treatment involves surgery and/or chemotherapy, and just like the disease itself, can lead to many complications, such as the need for colostomy, diarrhea, bloating, fever, and infections, which significantly impair the quality of life of the patient. Although there are many established non-modifiable risk factors for the disease, there are also many modifiable risk factors, many of which are closely related to the microbiota, such as diet, alcohol consumption, and weight. This led to the hypothesis that by manipulating the microbiota using the probiotics, we could lead to local and systemic changes that could improve the quality of life of the patients. The main objective of this review was to review the influence of probiotic supplementation on gastrointestinal symptoms and the duration of the pyrexia in colorectal cancer patients. Our study protocol was registered in the Prospero platform, which is an international platform for systematic reviews, and to ensure the methodological rigor, we follow the PRISMA guidelines for systematic reviews. For the review itself, we searched for randomized controlled trials on the databases PubMed Medline, Cielo, Biremi, clinicaltrials.gov, and Cochrane Library, published from 2000 up to 2021, using the keywords probiotics and colorectal neoplasms. Using this search strategy with our filters, we found 118 articles, which, upon further analysis using our inclusion and exclusion criteria, were cut down to 8 articles. These articles were analyzed for their risk of bias using the Revman software, which found an overall low risk of bias for all the articles. We also found low heterogeneity and low publication bias using the Eggers test, and the main characteristics of these studies were extracted into a table, our Table 1. The most common strains used in the randomized controlled trials included were Lactobacillus acidophilus, Lactobacillus plantarum, and Bifidobacterium longum. For the meta-analysis, we included outcomes that were evaluated by at least 3 articles, and they were incidence of bloating, incidence of diarrhea, and pyrexia duration. The incidence of diarrhea was evaluated by 5 randomized controlled trials, and we found an odds ratio of 0.40 with statistical significance. The incidence of bloating was evaluated by 3 articles, and we found an odds ratio of 0.47 with statistical significance. The pyrexia duration was evaluated by 3 other articles, and we found a standard mean difference of minus 0.48 with statistical significance. We compared the results found in our meta-analysis with other meta-analyses that included the same outcomes, and found no discordance in the literature, except for the fact that ours was the only one that found statistical significance in the reduction of the pyrexia duration in the group that was supplemented with probiotics. Therefore, we conclude that probiotic supplementation reduces gastrointestinal complications and the pyrexia duration in colorectal cancer patients. The main limitation of our study was the lack of randomized clinical trials evaluating the population and the outcomes that we established, and we feel like we would benefit from further studies analyzing the best strain combination in posology to obtain these benefits, and if these benefits are exclusive to colorectal cancer patients, or if they can be extended to the general population. Thank you very much for the attention.